Good afternoon, everyone, and thank you for joining us for the National Conference of State Legislatures Public Health Webinar Series. My name is Carmen Hansen, and I'm a Program Director in NCSL's Health Program, and I'll be your moderator today. Today's webinar is titled, How the Social Becomes Physical, State Policies to Improve Behavioral Health. We will describe the social determinants of health and how they influence not only our physical and behavioral health, but what states can do to address them and improve communities. To start off, I'd like to do a few housekeeping items. Today's webinar is a platform for information exchange and engagement. So over the next 60 minutes, we encourage participation through the chat box. So feel free to type your questions in there for the Q&A, which we'll have later. And also, just to get familiar with it, if you'd like to use that chat function to tell us where you're joining us from today, what state, what city, your house, wherever you'd like to say, just go ahead and put that in the chat box for us. And again, we will use that for Q&A at the end. So if you want to put questions in as you have them, that'd be great. I want to mention about the resources that we have for this webinar. And above the presentation window, you will see a couple tabs with one of them named Resources. Here you can find a download and PDF version of today's PowerPoint presentation, as well as some other handouts. Another tab is labeled Speaker, where you can read the full bio of today's speakers. You can access these tabs at any time during today's presentation. Today's webinar is being recorded and will be available on the NCSL website next week. Finally, I'd like to thank the Centers for Disease Control and Prevention for their support of this webinar. Here's our agenda for today, and after a few brief introductions, we will hear an overview of social determinants of health and health equity and how states address them from my colleague, Tammy Jo Hill. Following Tammy Jo, Shweta Haldar from the National Governors Association Center for Best Practices will share more examples of how states have addressed social determinants and improved health outcomes. After Shweta, we'll wrap up things with NCSL's Shannon Saul for an overview of NCSL's housing and homelessness legislation database. So we will wrap up our time together with Q&A, and after the presentation, we'll just have a housekeeping again and last minute closing comments. So again, please submit those questions through the chat box so we'll have things ready to go by the time we get to the end of the presentations. So to tee up today's topic, I pose this question. How was your 2020? And by that, I mean, how did COVID change your life? And how did those changes make you feel? Did you have a job change? Do you have stress about housing or economic situations? Did you gain the COVID-19? What about missing that valuable social and holiday time with family and friends? And as the pandemic has demonstrated, changes in these foundational parts of our lives are not insignificant. They influence how we physically feel, our emotions, how we behave, and changes the environment around us. Medical and social science defines these influences as social determinants of health. The epidemic has been credited for a significant increase in anxiety and depression among children and adults, as well as an unfortunate increase in substance use and opioid-related deaths. As this graphic represents, and you will see it again, these are the factors that make up the social determinants of health that shape our physical and behavioral health outcomes, such as those listed along the bottom of this graphic. While physical health describes the condition of our bodies, behavioral health represents how we act because of those thoughts, feelings, and emotions. Behavioral health includes both mental health and substance use issues and is traditionally treated by healthcare providers who diagnose and treat someone at an individual level, but it's not really addressed in a preventative way most of the time. Prevention is most effectively addressed collaboratively through multiple sectors, including healthcare providers, private sector, and community partners. Research shows that these interconnected social factors across the top of the graphic, described in anywhere from 5 to 15 categories, may be responsible for up to 50% or even 80% of someone's overall health outcomes. Research by state Medicaid and health systems found that their members had significant and multiple social needs impacting their health. These results led to healthcare systems screening for things like a person's stress level and living conditions, which may exacerbate or lead to behavioral health problems, including anxiety, depression, and substance use. Successfully addressing these factors may improve an individual's physical and behavioral health status and outcomes, which ultimately lead to not only healthier people and communities, but lower healthcare costs for public, private payers, and the states. So shortly, you will see a poll question on your screen. We would like to ask you, which of these social determinants of health do you believe plays a role in an individual's behavioral health outcomes? The options are education, access to healthcare, economic stability, social connections, or access to healthy food. And while you decide that and submit your answer, I will turn things over to Tammy Jo for her presentation and to share the poll results. So without further ado, Tammy Jo, the floor is yours.
Hi, everyone, and thank you, Carmen. It's great to have so many people joining us today from across the country. We hope that you're doing well here through 2021. As Carmen said, my name is Tammy Jo, and I'm a policy specialist with the NCSL Health Program. Before we dig into my presentation, let's go ahead and look at those poll results a bit. So the question, as a reminder, was which of these social determinants of health do you believe plays a role in individual behavioral health outcomes? I'm sure, as you could have guessed by looking at your many choices there are no wrong answers. However, I will note epidemiological and population health studies have shown social supports may play a larger role than other determinants in reducing behavioral health challenges. All right, so let's just dig right in then to what this really means. The social determinants of health are known as the condition in which people are born, grow, work, live, and age, and the wider set of forces and systems shaping the conditions of daily life. The social determinants of health have been a public and population health concept for over 50 years, but with the Commission of Social Determinants of Health established in 2005 by the World Health Organization, a global understanding of social factors contributing to good health and reduced inequities started. As Carmen stated earlier, this graphic here illustrates some of the many different contributing factors to one's overall health. The middle section of this graphic really breaks down those factors a bit more into the specific elements of this determinant. For example, food is one of the determinants contributing to a healthy life outcome. By reducing the possibility of hunger and having access to healthy food options, we can positively impact one's ability to grow, focus, and reduce long-term complications like type 2 diabetes and heart disease. States have taken notice of this interconnected system between supported social determinants of health and reduced physical and behavioral health challenges. As the previous slide illustrated, the social determinants of health encompass many sectors in a system, often making it difficult, if not just completely daunting, for a state to consider programs or policies that address these social determinants. Research has shown purchasing and regulatory levers are mechanisms states can use to encourage investments in population health through managed care and value-based Medicaid contracts. For instance, in Colorado, through their accountable care organizations, the state has prioritized areas of criminal justice, employment, chronic disease, housing services, primary and behavioral health integration, food access, education, and childcare. To meet these priorities, contractors are required to develop relationships with local community organizations, to implement social determinant of health interventions, collaborate on community health needs assessments, and develop or access a community resource directory. Similarly, in states like Nebraska and Michigan, managed care contracts are used to prioritize social determinants of health, such as transportation, housing services, employment, food access, and education, with similar contract requirements of developing relationships with those local community organizations and collaborating on community health assessments and resource directories. In the last few years, we've also tracked a number of states who are addressing social determinants of health through the Centers of Medicare and Medicaid Innovation Grants, or Section 1115 waivers. At a high level, these waivers allow states to use Medicaid funds to directly or indirectly address these social determinants. For additional information on Medicaid, our NCSL expert, Emily Blandford's contact information can be found at the end of this presentation. States have also prioritized actions related to social determinants in their legislative branch and other executive agencies. This year in New Jersey, Act 5233 was introduced and directs the Board of Education to include curriculum for middle and high school students on social determinants of health, health disparities, and health inequities, among other public health priorities. As well, Indiana's Family and Social Services Administration has created the Manpower Placement and Comprehensive Training Program. This program aims to help Supplemental Nutrition Assistance Program and temporary assistance for needy family recipients to achieve economic self-sufficiency through education and job training and placement. Social determinants of health can, at times, have a greater impact on population health rather than factors like biology, behavior, and healthcare access. Studies have suggested, especially poverty, structural racism, and discrimination, are some of the primary drivers of health inequities. Structural determinants of health inequities are social, economic, and political systems that contribute to social class inequalities in a community. Reducing health is important because they can be tied to historical, long-standing inequalities, but ultimately are avoidable. By removing obstacles for health outcomes like access to good jobs with fair pay, quality education, or housing and safe environments, among many other things, to reduce health inequities. Foundations like the Robert Wood Johnson and agencies like Center for Disease Control and Prevention have put forth recommendations for states and municipalities to consider as the determinants of health and health inequities within their communities. Common considerations include identifying health disparities in your community, implementing or modifying policies and systems to increase opportunities and resources needed to be as healthy as possible, evaluating and monitoring efforts using short-term and long-term measurement, and reassessing those strategies for improvement. Similarly, the Center for Disease Control and Prevention has recommended the concept of building health into all policies, a collaborative approach that integrates and expresses health considerations in all policymaking sectors to improve population health and communities. NCSL has tracked many bills in the last few years and will continue to during this general session on policies related to the social determinants of health and health disparities. So far in 2021, 83 bills in 19 states have been carried over, pre-filed, or introduced. Common themes for these bills include appropriations to identify, analyze, and address health disparities in access and health outcomes, as well as directing executive branch agencies to develop and promote statewide plans to address health disparities and health equity. In 2020, we tracked at least 160 bills across 26 states, 53 of which have been enacted. In addition to the common themes so far in 2021, legislatures last year also prioritized creating task forces and requiring data to be collected by race and ethnicity. Many of these bills can be found in the member-exclusive Bill Information Service webpage and our soon-to-be updated Health Disparities webpage. Links to these can be found also at the end of this presentation. Finally, I would like to highlight a few resources. If you would like to learn more about the social determinants of health, the Centers for Disease Control and Prevention and the World Health Organization have informational web pages that can be accessed here. Healthy People 2030 has also highlighted social and physical environments that promote good health for all as one of the 4 overreaching goals for the decade. And finally, the Centers for Medicare and Medicaid have just released their roadmap to address social determinants of health to improve outcomes, lower costs, and support state value-based care strategies. A few of those resources are listed on this slide, as well as on the resource tab here in the webinar. Otherwise, I'd like to thank you all for having me. And if you have any questions, please don't hesitate to reach out. As well, I've listed my colleagues' contact information here if you have questions regarding Medicaid or federal actions and resources. Thanks, Carmen. I'll turn it back.
Great. Thank you, Tammy Jo, for that overview of the wide variety of factors that contribute to health outcomes and how states address them. Next, we have Shweta from the National Governors Association Center for Best Practices with more examples of using social determinants of health to improve health outcomes. The floor is yours.
Great. Thank you so much for having me on this webinar. My name is Shweta Haldar, and I work for the Center for Best Practices at the National Governors Association. To give a little framing and background on NGA, we are the bipartisan association of the nation's governors, and we're divided into two separate sections, the Center for Best Practices and the Office of Government Relations. The Office of Government Relations handles federal advocacy lobbying efforts, and we at the Center for Best Practices focus on, we serve as a kind of hybrid think tank consultancy that works exclusively with governors' offices to highlight some promising state examples. So here's some of the things I'm going to discuss during my presentation, and I'm going to focus really on highlighting some of the work NGA has done with states and some promising state and local examples. So we've already gotten like a really great overview of like what the social determinants of health are. And I'm going to just offer a really brief framework for the different factors that social determinants of health interventions can target. So if we picture population health as a stream, upstream factors are things like really macro level things like structural inequities, larger social conditions, things that are impacted by things around public policy and legal and sort of other really macro level things. And interventions related to these factors would often be interventions related to changes in laws or regulations. So an example of a really upstream intervention would be the health in all policies that Tammy Jo discussed, which embed public health and equity related considerations into decision-making processes across a wide array of sectors. Midstream social determinants are the individual social and economic needs that result from the upstream determinants, and these include things like housing instability, poorer neighborhood conditions, less access to nutritious food. And interventions at this level focus on connecting the individual to needed social and economic supports. Finally, downstream interventions typically occur at the point of service and provider level and relate to improving access to quality clinical care and insurance coverage. So I'm going to go over a few different strategies for integrating social determinants of health into policymaking at the state level primarily. So the first strategy I'm going to discuss is for integrating social determinants in a state policy relates to integrating physical, behavioral health, and social and economic supports through Medicaid. So this strategy is especially essential for populations with complex health and social needs. These individuals are a very small percentage of Medicaid enrollees, estimated at about 5%, but they account for nearly 50% of Medicaid costs. And part of the reason is the lack of integration of services provided through different payers and programs. So if you're managing chronic disease, serious mental illness, substance use disorder, and also housing instability and homelessness, you're interacting with many different programs and payers, and your care may be very fragmented. Research indicates that more coordinated care results in better outcomes, lower emergency department usage, and lower costs for the state. So a model state for systematic and sustained integration of behavioral, physical, and social supports is Arizona. Prior to integration for most enrollees, behavioral health services in Arizona were carved out and managed by entities called regional behavioral health authorities, while physical health services were managed by the state's Medicaid agency called Access and its managed care plans. In 2015, the state merged its behavioral health agency into its Medicaid agency, while simultaneously pursuing integration on the health plan and provider levels. This shift meant that the Medicaid agency now had 114 staff members focusing on behavioral health, including many new staff focused on getting enrollees connected with housing, employment, peer support services. The new integrated system, which was called Arizona Complete Care, also contributed to more strategic purchasing initiatives aligned across physical and behavioral health sectors, and increased rating and blending of Medicaid and non-Medicaid funds to pay for non-medical needs. And this was responsible, has been determined to be responsible for a transformational culture shift within the agency from focusing on clinical care and patient diagnosis to population health management and the broader social determinants of health. Another promising example of a state pursuing greater integration of different kinds of supports through Medicaid is North Carolina's Healthy Opportunities pilot. The Healthy Opportunities pilot is funded through the state's and designed through the state's 1115 demonstration waiver, which can be a really powerful tool for financing social determinants of health interventions. The pilots will provide, when they're implemented, will provide up to $650 million in Medicaid funding for services in 3 areas of the state to start. And services will be related to housing, food, transportation, and interpersonal safety. North Carolina's Department of Health and Human Services released an RFP to select lead pilot entities that would implement the pilots in November 2019, and the process has been understandably held up by COVID, but awards will be announced in March 2021. And I have a few other examples here, which are elaborated on in NGA publications I'll provide a link to. These are California's whole person care pilots and Rhode Island's Medicaid health homes. And each of these focus on greater coordination of health, behavioral health, and social supports, specifically for vulnerable populations with complex needs and high costs. So another area for greater care coordination that relates to the social determinants of health is integration on the data system level. So again, for especially complex care populations with lots of needs, interacting with many different programs and having data stored on multiple different systems that don't talk to each other can lead to fragmented care and poorer outcomes. A state that's been a huge innovator in improving data system integration is Michigan. Michigan carves out behavioral services for enrollees with serious mental illness and substance use disorder. So to assist with coordination and data sharing, the state has developed a platform called Care Connect 360, which is a web-based tool that facilitates coordination across programs and payment systems. The platform has contributed to data-driven policy decision-making. For example, in 2015, the state was able to identify almost 3,000 Medicaid enrollees with over 20 emergency department visits in the last 12 months. And due to the integration provided by the platform, it was able to determine that 16% of this population was homeless. So the data matching provided the foundation for a permanent supportive housing pilot for these frequent emergency department users starting in summer 2018. Finally, I'm going to talk briefly about a strategy that was already discussed in the previous slide. So integrating health and housing services. So Medicaid enrollees with stable housing are demonstrated to have lower healthcare costs and better outcomes than those without housing. Medicaid can't be used to pay for rent, but there are a lot of options to use Medicaid to pay for supportive housing, and also an option that some states have adopted to pay for tenancy supports, which can be defined very broadly. A state I wanted to highlight is Washington State with its Foundational Community Supports Program. The Foundational Community Supports Program is a core part of Washington's larger Medicaid transformation strategy, which kicked off in 2018. Foundational community supports include both supportive housing, including landlord relations, identification of housing resources, support obtaining a lease, and also include supported employment and job placement services. The services are available through to people experiencing chronic homelessness and a number of other risk factors, and also chronic disease and other health needs. There are a number of states that have sought Medicaid reimbursement for a diverse range of housing-related services as well, and a few of them are listed here. NGA also has a Housing as Healthcare roadmap that provides many state examples and also a step-by-step guide to building these kinds of programs. So I'm going to just close by highlighting some of the work that NGA is currently doing or has done around the social determinants of health. Right now, we are operating a learning lab with 5 different states around addressing adverse childhood experiences and trauma, and previously have done a lot of work around suicide prevention, complex care populations, and have a number of these publications available on sort of the building blocks, a lot of these programs. That's me.
Great. Thanks, Shweta. Those are helpful examples showing how there's many diverse ways and tools to address the social determinants of health and improve those health outcomes for those complex populations. As highlighted in Tammy and your examples today, housing stability is a very common focus of state actions. Another example of addressing housing stability comes from Pennsylvania. The University of Pittsburgh Medical Center Health Plan partnered with Community Human Services to secure permanent supportive housing and provide care coordination for individuals experiencing homelessness. For each individual who received housing supports, the health plan saved, on average, over $6,300 per year in healthcare costs and improved people's physical and behavioral health. Now, that's what I call positive outcomes. And for our last presentation today, we have Shannon Saul with an overview of NCSL's Housing and Homelessness Legislative Database. Take it away, Shannon.
Thank you, Carmen. So my name is Shannon Saul, and I am a research analyst with the National Conference of State Legislatures. I'm in the Children and Families Department, so my topic areas include child support, early childhood education, housing and homelessness, and family economic supports. But our department covers everything related to human services and overlaps with health a lot, as you could probably imagine. So I'm here just really quickly to tell you all about our housing and homelessness legislation database that provides information about all introduced legislation in all 50 states and all U.S. territories. So like I mentioned, this includes all introduced legislation, including failed legislation, pending legislation, and enacted legislation. So this database is updated at least weekly, although we track bills more often than that usually, so it is very up to date. And it is also searchable by year, keyword, topic, and status. So you can choose to search for certain bills from a certain session based on a certain topic, or if you want to search just enacted legislation, you can do that as well. I wanted to point out, as you can see circled on this slide, there is a way to contact me and my colleague, Sarah Scherer, who cover this topic. And our contact information is also later on in this slideshow if you want to see it there. So I want to show you all how to search using our database, because it can look a little intimidating when you first stumble upon it. So there's a couple ways to search using our database. The first is to filter. So as you can see, this is a screenshot from our database. At the top, you can filter by topic. So as you can see, there are topics such as adult and family homelessness focused on employment, emergency response, etc. And you can also filter by states. So if you want to search all states or one state or a certain region, you can also do that here. And we also provide definitions for each of these topics on our webpage. So if you're not sure what we mean by a certain category, you can find that information there. And then the other way to search using our database is this search bar at the bottom. So you can search by keyword, meaning if you type in a word, it'll come up all of the bills that have that word in their summary or in the bill text. And then you can also choose what status you want. So if you want to search enacted legislation only versus introduced legislation. And then if you have a specific bill number or a specific author that you're searching for, you can also do that there. So here's an example of a filtered search that I did. So in this search, I filtered for housing related to veterans, and I chose to look at all states, and I looked at just enacted legislation from the 2019 session. So as you can see on the right-hand side of this slide, it brought up 4 bills from 3 states. And then I'm able to scroll through these bills, read a summary of them, see the date of last action, the author, the status, and then if you click on the bill where it's blue at the top, it takes you to the full text of that bill. And then here is an example of a search that I did. So as we've been discussing, housing is a large part of the social determinants of health. So I chose for this presentation to search the keyword health. And I looked at all topics in all states, all statuses, and all years. So this brought up 109 bills for me from 26 states. In the 2020 session, housing bills were dominated by COVID-19, which obviously has a large overlap with health. Many states have imposed eviction moratoriums and other temporary housing legislation during the pandemic, including rental assistance and helping the homeless population during this time. So here's an example of a bill that relates to developing an emergency response plan for folks experiencing homelessness during the pandemic. So as you can see, this result came up because I searched for the keyword health. I've circled it there in the summary for this bill from Utah, and that's how I came across this bill. If I wanted to look at the full text of this bill, I could click on the name of the bill at the top of the screen. So thank you all for having me and for thinking about housing as a part of the social determinants of health. If you have any questions related to housing or you want to know more about the database, here is my contact information along with my colleague who works on this same issue with me. And with that, I turn it back to you, Carmen.
Thanks, Shannon. And this brings us to the Q&A portion of our event. And while you all submit some questions down in that chat box, we do have a few questions to start with to give you another minute or two to send those in, and we will get to as many as possible. So the first question I have is for Tammy Jo. And if legislators are interested in understanding the social determinants of health in their state, what would you suggest as the next best step for them to take?
Yeah, thank you. That's a great question. I would definitely recommend meeting with your state or local public health or health agencies to learn about programs or pilots that they may be already working on in this space. They might also be able to highlight some health disparities within your communities, or help you conduct kind of an environmental scan and figure out what your priorities for your community are. I'll also highlight the considerations that were there in my slides, that, you know, once you kind of have an understanding of health disparities and the need within your community, to consider looking at maybe modifying or updating some existing policies, creating long-term or short-term goals to help address those, and then be open to reassessing the process and outcomes for keeping those goals in mind.
Great, thank you. The next question I have is for Shweta. And you described in your presentation a lot of things related to Medicaid and other ways to address the social determinants of health through state agencies. And since you're with the Governors Association, can you give us a sense of how many of these initiatives are started by governors?
Sure. The initiatives I discussed primarily didn't start in executive branch agencies, and there aren't that many governors who talk about the social determinants by name, even though governors have a lot of interest in reducing healthcare costs, which all of these interventions are related to. But there are a lot of social determinants interventions by other names of governors who've demonstrated interest in. One area is adverse childhood experiences and trauma, which has been a source of great interest for governors over the past few years. And there are some, and as you know, adverse childhood experiences are traumatic events or events that can contribute to trauma that happen when people are children, and have been documented to result in poor health outcomes. And some examples are in Delaware, the governor signed an executive order officially declaring the state trauma informed and creating an action plan around addressing trauma through each state agency. Another example is in California, where Governor Newsom appointed a surgeon general who was specifically focused on ACEs and trauma. And another area in which social determinants are relevant and which governors have demonstrated a lot of interest in is in cross-sector collaboration. So a number of states have developed entities called children's cabinets, which are groups that are like cross-sector collaborative groups that focus on sort of a whole person approach to children's health and success. And these groups often have representation from each cabinet secretary and are often established by the governor. So examples are in Maryland, Governor Hogan has played a major role in sort of backing up and providing a lot of authority to his children's cabinet, which primarily focuses on criminal justice and juvenile justice and like really cross-sector approaches to better outcomes there. And another in New Mexico, Governor Lewin Grisham has also demonstrated a lot of interest in promoting early childhood interventions through her children's cabinet.
Great, thanks. It's nice to know how governors see these issues and address them, even if they aren't using the term social determinants of health. You know, that's kind of the buzzword in the health and social services sectors, but isn't necessarily transferred into policy. So it's really important to know that, to look for these individual words as well when you're looking for policy ideas and things like that. So thank you very much. And we have a question for Shannon now. And other than COVID-19 related bills, what other trends have you noticed in recent housing legislation or homelessness related topics?
Sure, that's a great question. So as I mentioned, COVID-19 has dominated the housing legislation space over the past year. But in addition, we've also seen a large number of bills attempting to tackle race equity in housing, whether that's tackling historical inequities in housing based upon race, or moving to integrate communities, things of that sort. We've seen a lot of bills introduced on the topic of race and housing this past year.
Great, thank you. I do have a question from the audience for right now. Do we have, so the question is, I think we might be able to start with Shweta on this one and or Tammy Jo. So the question is, how do we build the case for going upstream while trying to address problems that feel more immediate in our lives? So I think it's upstream for prevention and things like that, even though we feel them on like a personal level.
Yeah, that's a great question. Swetha, I'll let you speak as well, but I think, it's really starting to think about it as that stream effect. So while we want to go upstream and we want to talk about prevention, there are absolutely those immediate needs to address. And so thinking of it more, I have read a lot about, that really talks about creating some of those short-term, long-term goals as well. That way you're working on multiple parts of an intervention and prevention while ultimately just trying to work your way upstream, but you're seeing those incremental bits of growth and hitting goals.
And I would just add that I would provide Arizona as a great example of a state that managed to sort of go upstream while simultaneously tackling midstream and downstream factors. So the complete care transformation happened at the administrative level, which is very high level, but also at the provider level and the plan level. And I think that those things can happen simultaneously. And that had great, that transformation had great outcomes for enrollees, but also created like a transformational culture shift. So I think that the best programs and policies work on each of those factors simultaneously.
Great. Thank you for those responses. I have another question. And could any of you address the issue of the role of employment as being a key role for employment first and the data on IPS for persons persistent with mental illness, and that SAMHSA has added employment as a tool for mental health recovery in 2012. And rather than employment can be considered after the person has recovered, hopefully, I guess this might be more of a comment, hopefully states can see the need to invest in restructure and to focus on outcomes and not units of service. Do you have any, does anyone have any thoughts on the role of employment with here? I feel like it's just it is usually the basis for someone's economic security, so that kind of straddles both their housing and their financial, which also then leads to their social supports, because a lot of us depend on our jobs for friends and social interactions and things like that, even if they're all through screens these days, or for a lot of us at least. Does anyone else have anything to add?
I'll just say I'm not on our employment team here at NCSL, so that's not my area of expertise. But I think kind of similar to what Carmen was saying, this emphasizes the need to kind of look at the whole person and the whole picture of economic security, which includes employment and includes housing. And it's important to recognize how that intersects with the social determinants of health as well.
Thanks. Does anyone else have any thoughts?
No, I think that's great. And I completely agree that the part I'm thinking about as well, I know in reading in previous work that the Centers for Medicare and Medicaid have tried to do a lot of work around also helping folks with intellectual or developmental disabilities and getting them connected to supports and housing supports or employment supports. So in Colorado, for example, I know that their Medicaid office has had to work with their health department, Health and Human Services, as well as some of the environmental programs to kind of help with those connections. So I think really to see and identify how those connections work within your community has been key for some of those programs to be successful, knowing that you don't have to have all of those supports for employment or housing coming out of one branch or one agency.
Great. Thank you. Does anyone else have anything to add?
I just uplift the example I discussed during my presentation around foundational community supports in Washington, where the state was able to finance really extensive employment supports that were interwoven with housing supports and tenancy supports, and really like approaching the whole person and all of their needs. So that's like definitely a model program to look at to see how some of this work can be financed.
Great. Thanks for pointing that out. A lot of these programs have so many factors and facets to them. It's hard to know, which programs are touching which topics. So thanks for pointing that out. I have another question for Tammy Jo. While this webinar is, really focused on those social determinants of health, we also hear of terms like adverse childhood experiences or ACEs and things like health equity. Can you describe how these are related or different or the same?
Yeah, absolutely. And I think Swetha did a great job in her conversation talking about this as well. But I think if we just look at it kind of at base level, adverse childhood experiences are generally marked by just that, an experience that a child's gone through. So when a child will live through some kind of traumatic event, whether it can affect their ability to help them build resiliency and self-sufficiency. So these experiences can generally be direct, maybe the death of a parent, or indirect, like watching news coverage of, say, a national or environmental disaster. Nonetheless, they can affect the child in some way. But we can also see from social determinants of health, an average childhood experience, also lack of housing or access to healthy food over a long enough period of time. If these are not addressed, then these social determinants can have the potential to build into an adverse experience for a child, resulting in that longer term health or behavioral health challenge.
Thanks, Tammy Jo. Does anyone else have thoughts on how to compare those, or how they're different or the same?
So at NGA, we're currently working on a project around addressing ACEs with 5 different states, and looking to Tennessee and California that have really really model states in this space. But one thing I would emphasize about adverse childhood experiences is that they're not synonymous with trauma. Adverse childhood experiences can develop into trauma through toxic stress, and having various other sort of negative sort of factors in your living environment can make adverse childhood experience, and a lack of social supports can turn adverse childhood experiences into toxic stress and trauma. So having positive social supports, positive experiences can actually create, and protective factors present can actually minimize the impact of adverse childhood experiences on a child's larger outcomes and health outcomes. So social determinants of health are really relevant here, because if those protective factors exist, and if states can work on building up those protective factors, the impact of adverse childhood experiences is minimized.
Great, thanks, Shweta. I'm seeing that there's some resources also being shared in the chat, so keep that up if you have great things to share. As participants, we know you all have your own stash of resources for your states, or even national resources and databases, things like that. We love data, so we want all that stuff at our fingertips. So the more you share, the more we benefit, as well as the other participants. So thank you. And I have another question for Shannon. Shannon, do you have any insight about what to expect for legislation and housing and homelessness issues for 2021? Anything different, new, about the same? What do you think?
Yeah, that's a good question. So I'll preface this by saying I'm always hesitant to try and predict what legislatures will do. But with that said, I think that there is likely to be a continuation of a COVID focus, but there might be a shift in terms of what that looks like. So it may be less about responding to the pandemic in an immediate way like it was before, but more about rebuilding and helping folks catch up on rent that they might have missed during the pandemic, that sort of thing. But I would expect that a lot of it still focuses on COVID and housing. It just might shift in terms of what approach they're taking and what part of the process they're approaching that. Yeah.
Great, thank you. I have another question I think this one will go to Tammy Jo, and then Shannon may have something to add as well. And also we'll have Shweta chime in on the NGA side of this. Behavioral health as a whole issue right now has been really kind of catching on and gaining a lot of attention with, the opioid epidemic and just substance use disorders in general, and substance misuse, and the lack of resources, and how to have a comprehensive system to address all of these, from, all the stream parts of the stream, the upstream, midstream, downstream that Shweta was showing in her slide. Tammy Jo, can you talk a little bit about what some of NCSL's other behavioral health work looks like right now?
Yeah, absolutely. So that's a great question. We are here for you as our members. So we have a lot of resources. We've kind of got, I'll speak for the health team. We have got several of us that focus on different parts of behavioral health. So whether it is looking at kind of that prevention and intervention aspect, I myself also help focus on youth behavioral health challenges and substance use for mothers or children. And so I think that we have quite the range as a health team that address those behavioral health challenges. And I know that we intersect and we work closely with folks in NCSL as well. So we often will work with our criminal justice team, say that we are looking for information around people who may be having behavioral health challenges and have had some cross with the justice system as well. So I'd like to think that we have pretty much every topic covered, but if we don't, we are happy to take that topic under our wing.
And I can just chime in and kind of echo that in terms of how all of our topic areas intersect and how all of these social determinants of health also intersect. The substance use also is a topic that comes up in our housing and homelessness legislation in terms of there are a lot of states that introduce legislation that are targeted at specifically people experiencing homelessness that might have substance use disorders, as well as transitional housing for folks that might be justice involved. So that also brings in our criminal justice team as well as you all in the health team. So this all is very much integrated together.
Thanks, Shannon. Yeah, I was going to mention the justice involved side of the discussion that our criminal justice or civil justice group works on. And we all are kind of one big behavioral health family in some ways because we do cross into so many teams at NCSL. I appreciate that. Shweta, do you have anything to add on NGA's other behavioral health related work?
Sure. Right now, our primary project around behavioral health is around addressing adverse childhood experiences and trauma, where we're working with 5 different states to create strategic plans around how to incorporate trauma into policy decision-making across agencies. We've done a lot of different publications around different aspects of behavioral health that are on different subjects, primarily the intersection between COVID-19 and behavioral health. So we released a paper a few months ago around strategies for social isolation and loneliness that have been produced by social distancing strategies and other COVID mitigation strategies. We have like a huge lot of stuff around STD, substance use disorder and opioids happening, but I don't know too much about that. Yeah, and we're also even like working on just integrating behavioral health into all of our projects. So we work a lot on chronic disease, and there's a lot of like bidirectional relationships between chronic disease and depression. So we're bringing that angle into our chronic disease prevention work, which is funded by the CDC.
Thank you. Yeah, I know a lot of us are working and adding behavioral health to everything because it is reflected as the social determinants of health show, you know, all these things are foundational in our lives and that affects our physical and our behavioral health. So there's no surprise that I guess we're kind of bringing it into the fold and under all these different topics because it fits and it's appropriate. So thanks for sharing that. Another question for Tammy Jo. This COVID time, 2020 in general, has had a really significant impact on the lives of children right now, particularly with anyone through that K through 12 grade age right now is now learning primarily online, or at least has been for a large portion of this last school year. Can you mention anything about, you know, I know that does lead to maybe ACEs or things like that, but can you talk about some more resources that might be around for children and their behavioral health needs?
Yeah, absolutely. Thank you for that question. So I'm going to just plug in CSL first and say we do have a great education team that focuses on this aspect from that perspective of being in school and working through that social emotional learning piece. But to plug my stuff a little bit, sorry about that. I will say that we also have resources for youth behavioral health on our website, and we'll be getting more coming soon. We've been working with the Bain and Family Foundation actually on a brief. It's going to be coming out this month. It'll be around enhancing school capacity to support children's mental health. And I think that this piece is beneficial in this time because it acknowledges that these were issues many of our members and states were looking at prior to COVID-19, but was really heightened by COVID-19. So we've seen even more around the social isolation piece, the virtual learning, the stressors of having everybody at home all the time. So I think that this piece is really great, how it will be able to highlight some of the comprehensive pieces or core pieces of what some of those national indicators from SAMHSA or the University of Maryland have been able to talk about, as far as here are some steps that you can take to help with children's mental health or behavioral health challenges. So this will be a really great resource to be able to help states consider 1 to 2 options or things that fit for their community or for their children as far as those needs go.
I'll also just jump in. Go ahead, Tammy Jo.
Came late to me, but I was just thinking about my colleague, Charlie. He also the topic of suicide prevention. And I know that that's also been a big discussion during this time and with our members as well, especially for youth. So I think looking at some of those suicide prevention programs or policies or things that states are doing is also really beneficial. And we've got information on that too. Sorry, I'll do that now.
No worries, that's fine. I was just also going to say in another NCSL plug that my team also covers early childhood and has some great resources on the NCSL website as far as that goes in terms of intersecting with health and economic success and all of that.
Thanks, Shannon. Thanks, Tammy Jo. Thanks for giving Charlie's work a shout out. We know we've been getting a lot of hits on the prevention side, and the suicide topic in general, unfortunately, has been of concern, and a lot of new information is coming out and related to COVID and other things in society right now. So thanks for that. One last question, I think, will be, Svetlana, are there any other things that NGA is up to regarding any of these issues that might be worth sharing, or what you might have coming up, or any events that you might have or that NGA might be hosting that NCSL legislative branch folks might be interested in?
Sure, yeah. I don't know if there's anything that is open right now, but in terms of convenience, but we definitely have a bunch of publications coming out that might be helpful. Right now, NGA is with the Duke Margolis Center for Health Policy convening different states. A number of states have created task forces around ensuring equity in COVID-19 response. So we're currently convening each of those task forces monthly, and using that as an opportunity to share best practices around equity. And emergency response and the intersections there. And since equity is a crucial element of social determinants of health, I think that's relevant. One thing that will be publicly available, we're coming out with a number of deliverables highlighting some of the most promising states in our cohort and some of the things they've done, and they're across the political spectrum. And we're also currently just getting started on a project around rural health and dealing with disparities in rural areas, and also promoting community development. So those are some of the other things we're doing in this area.
Great. Thanks for sharing that. I know we have a lot of NGA resources in that resources document on the resources tab. So everyone start clicking away and downloading that, because it will be really helpful as you look into different aspects of this issue. I have one last question before we wrap up with Tammy Jo. Tammy Jo, we've heard the word a couple times today, health equity, used it in your presentation too. What else is NCSL doing on health equity specifically?
Sorry about that. Looking for the unmute. Yeah, that question. I think that this is one of the things NCSL, from the health perspective, again, I'll speak with, we've focused on this topic for quite some time. We've had meetings on maternal mortality. We've worked with legislators to better understand some of these health inequities. But I think that we're also looking into it more in depth as well. So we actually will be having a task force meeting of some of our health officials or our health chairs for our members and Quad Caucus at NCSL to begin really to understand and look at what health equity is and how states are approaching. So we will be having some informational webinars and meetings with these folks. And so I think that it's work that we have integrated and will continue to integrate into things that we are working on and researching. But I would say that we have seen an uptick as far as questions from members or policies being put forth in it as well. So I think with the disparities being brought to light more so with COVID-19 this last year, this will just be a topic that we continue to see grow. We also have a webpage I'll plug that should people want more information, it's the NCSL Health Disparities webpage, and you can follow kind of what that task group will be doing there.
Thanks for that. Yeah, I believe I also added that to our resources page. So like I said, we've got a lot of information on the NCSL page. I can't even begin to count how many pages we have on in health alone, but we have topics from A to Z. We have dozens of legislative databases on all legislative related topics. So please find what you need. If you can't find what you're looking for, use our search term or even just Google NCSL and then the topic you're looking for, and you'll probably come to some sort of resource that, on our website. So, and Tammy Jo, real quick, can you describe what the Quad Caucus is for people not used to hearing that term?
Yeah, absolutely. You're going to put me on the spot because I know that there are, I only know the acronyms, and I apologize, I should know these, but we have the Black Caucus, the Hispanic Caucus, the Asian Caucus, and the Native American Caucus. And these folks help advise our work, and they are our members, but also they help to focus on their branches. Also, they are NCSL members, but they lead as the Quad Caucus on issues that are important to them and for their communities too.
Great, thanks. Yeah, those acronyms are quite long, so that's fine. That's a great description. All right, well, that closes out our Q&A segment today, everybody. I want to thank everyone for your questions and your participation. And as we close, please help us out and earn some good karma points by completing a very short survey at the end. Your feedback helps us identify and support your work on this and other important issues. And another plug, don't forget to download that resources document under the tab above, and you'll find at least 40 resources from today's presenters and even more. So while this may be the last, it is not the least in a series of 9 webinars in NCSL's public health series. But don't be sad, all 8 previous and excellent webinars are archived on the NCSL website for your binge watching pleasure. It is enough to make Netflix jealous, let me just tell you that. They are also listed in the resources handout, again, under that tab at the top. So the last thing I to say is thanks again to the CDC for their support of this webinar today. And a final thank you to all of our presenters and all of you that joined us today from across the country. We greatly appreciate everyone sharing their time and your expertise today on this very important topic and a very busy time for state governments. So thank you and good health to everyone. Enjoy the rest of your Friday and the weekend ahead.